Some people might be saying that, oh, doctors are even using this AI to diagnose us. You can't go to school for 6 years and come out not knowing anything.
Right now, currently as you speak or at the moment, do you really think that AI is better than humans right now?
That there will be a certain point in human life whereby we will have what they call super intelligent systems. That is AI that are more intelligent than humans, and nobody knows exactly what they will do to humans. Well, let's face it, AI will replace certain aspects of the healthcare and it will displace certain individuals.
Immediately somebody sits in front of you and that person tells you, I'm coughing. You know the amount of information that come in your head just that split second. You're thinking about the lungs, you're thinking about the heart, you're thinking about the truth.
If a patient is given the opportunity to choose between being cared for by AI and then a human, which one will you think the patient will opt for?
Okay, so to answer this question, I'll use an article that I read recently.
Recently, we got the information that somebody committed suicide just because a response an AI gave to them was very disheartening.
The trust that you give to a human being that you can see, feel, and touch will never be the same as the one that you give to a system that can feel.
If we take AI out of the medical space now, we might feel so uncomfortable because there are certain things that AI can do that we might not be able to do now.
Okay, so finally, looking maybe 20 years ahead from now, maybe 50 years, what role do you see AI playing in healthcare? Hello everyone, and then welcome to another episode on OPT Podcast, a space where we talk about trending and then interesting health-related topics. So I am Wumi Okujo, your host for today. So today in the studio with me, I have two fine young men. To my left, I have Mr. Nicholas Bwedu, and then to my right, I have Kofi Boache. Okay, so the question for today, AI versus healthcare. Can AI replace doctors? That is the question. Okay, so before I start, there was this speculation in the country of Armenia where they introduced AI ministers to help combat corruption. Those were speculations. So can the same thing happen in healthcare? So I want to start with you, Kofi Wache. So do you really think that AI can replace doctors?
Okay, thank you for the question. So it's actually interesting because and a fascinating question because years back, few years from now, if we had placed drivers in our position and asked them this same question as can AI replace your work, they would have maybe hit their chest and say, no, I don't think so. I think AI cannot replace my work. But fast forward now, AI has totally replaced them. And looking back also, we realized that at a point where we were thinking of using land, somebody was in their space thinking about how to replace traveling via land and going into the air. Somebody would have thought this thing is not logical, it's not possible because due to the laws of gravity, these things are not possible. But today, the safest means of transportation is via flight. So to answer it as a yes or no would be very, very difficult. But the only thing the only bracket here is even the AI knows that all those aspects he's been replacing are solely technological spaces. And here we are talking about the health space. So AI cannot replace all of the medical space, but an aspect of it. Wow. So in the health sector, we look at history, which in the history aspect, an AI can take care of it. Asking you questions, clarifying things, and that's what you do when you enter the consulting room. But remember, in the health sector, immediately somebody enters the consulting room, that's when our diagnosis starts. So being on your bed and typing, the AI cannot tell whether you were limping, whether your facial expression showed that you were in severe pain. Meanwhile, the professionalism of our work, it starts from right from when the person is talking, how they are stammering, whether the person is in pain, if the person was crying. The AI cannot feel this emotional aspect to be able to compensate psychologically. And you remember that our treatment method is not only that the drugs, it goes in depth. So AI replacing us will not be totally, but a part of us. And this part of us won't be replaced, it will just be augmented. So in this space, we are looking at the AI dealing with history, but examination is when we, the doctors, legally or professionally tend to touch some space or an aspect of a person so that you'll be able to diagnose. And remember, we are able to diagnose someone about 50%, about 50% diagnoses are made just after doing our examination. So the AI cannot go through this aspect of our space. Also, something like investigations. AI can tell you the list of investigations you might need, but as in our profession, before we request for investigations, we look at the financial aspect of the person, the resource we are having, and even the facility we are working in before we request for these investigations. And even if an investigation is requested, you need a professional request to be able for the lab scientists to accept and go through it. At the end, looking at the treatment aspect, if someone, there are some drugs that are over the counter. That's because for them, we've tested and got to know that even regardless how someone might abuse it, the side effect might be less. But looking at drugs that we have to prescribe without the signature, the authorization of a professional who has gone through these years of experience writing it and signing, you might not be able to buy those kind of drugs. So AI can suggest a lot of things, but just remember, an AI told you to come and see us after telling you everything you think they might replace us and going through this space. So AI won't totally replace us, but can take an aspect of us.
Okay. So to clarify, what you are trying to say that there's a possibility that AI can replace, but just some aspects, not the whole healthcare or the whole medicine entirely.
Exactly my point.
Okay, that's wonderful. Mr. Nicholas, I also want to come to you with this question. Okay, so do you really think that AI is better than human beings, and in this case, health professional right now, currently as you speak or at the moment, do you really think that AI is better than humans right now?
Okay, so thank you very much for the question. I don't think AI is better than human being professionals as at this current moment. Yes, AI may perform better in certain aspects of the healthcare, but then ultimately, currently, per the technological advancement we have now, the human beings will outperform most of the AIs when it comes to the issues relating to healthcare. So when it comes to things like diagnostic medicine, where we are using imaging, some investigation, some values and those things, because AI has the ability to analyze large volumes of data and then bring out an output based on a certain prompt you've given to it, it will be able to tell you that, oh, based on the knowledge that I have, knowledge in this sense means the data that I've been fed with, this person is suffering from pneumonia, this person is suffering from pneumothorax, this person is suffering from that. AI can do that for thousands of patients within a minute. But then when we consult a radiologist to do these diagnosis for us and read the films and all that, it will take him days, if not years, to actually finish writing the report for all these thousand individuals. So that is where the AI outperforms the human being. But then when it comes to parts of healthcare, as you rightly mentioned, where the human presence is really needed, in fields like psychiatry, in fields where people are going through pain, like maybe a child loss or something, and they need a human being to reassure them, to console them, and do those things. Because AIs do not have the cognitive ability and they do lack emotions, they won't be able to perform these functions as a health professional, provided we give them access into that space. So yes, there are certain aspects that the human being will outperform the AI, and there are also certain aspects that the AI will outperform the human being.
Okay, so if I also get your point, it depends. So at a point or in certain aspects of medicine, AI can really outperform human beings. AI can really do like perfectly over there. But then when it comes to other aspects, like maybe the examination, where maybe you need physical touch, there's no way AI can outperform a human being over there. Okay. So the next question, Kofi Bach, I want to ask you this question. So, what do you think are some of the perceived benefits that when we integrate AI into healthcare, we can get, or some of the outcomes we can get by integrating or incorporating AI into healthcare?
Okay, thank you very much. So, with benefits of AI, my brother here already said something about AI is able to analyze a huge amount of information in a short period of time. Human being would have been exhausted if maybe that same amount of information was given to them. Maybe we are being given thousands patients or thousand list of history to go through. But an AI, even if thousands of people are interacting with it, giving them their signs and symptoms, for it to analyze what might be the probable diagnosis, the AI can take them through. So one, the benefit is it being able to analyze a lot of data, and also it can also incorporate research backing and things so that it will request certain specific questions to them in order to rule out some differentials. Another important benefit is AI, anytime someone, because currently the literacy rate is still increasing, a lot of people can interact with it, and with that, they are going to get some form of information about what's happening to them. At least they will have a list of differentials, even if it's five. They have a list of differentials that they might psychologically sync with it. They might even read about it before they come to us. So with that, it makes the work easier for them to perceive it if we are thinking similarly or if we are thinking otherwise. So if we are thinking similarly and they share with us, oh, I googled, or I asked an AI about my symptoms and they said this and this and that, we might physically tell them the reason why this one is not possible, this one is possible, and we would physically also interact with them, telling them investigations that we want to use to rule out the possibilities. So an AI might generally tell you about maybe an antibiotic that you want to request. But based on our local protocols, we might not use the antibiotic because maybe the antibiotic, the bacterials around might be resistant to that specific antibiotic. So they would have a fair idea about the condition before they also come to us, which will fast track our whole conversation with our patient. So before they pre-book, normally it's not done in a local setting in Africa, but foreigners in the foreign lands, it's an appointment. So before the appointment, they can read about their conditions, get an idea about it, so that when they come and you're having conversations with them, because they've read about it, they can also ask further questions that we would use to clarify based on what they've read. But imagine somebody just come and it's at the hospital that they are hearing some terms and certain things for the first time. It becomes bulky for them. And sometimes psychologically, imagine part of the differentials and AI tells them cancer is part of the differentials. It has put both positive and negative. Since you are talking about the advantages, let me tell you the advantage. The advantages is the person has now synced the mind in a way that, oh, it's a possible cancer. Even though they might be feeling so bad, people want to be told the truth. And AI currently might have no emotions and will just list it as it is. Yeah. So if the person perceives it and comes to you as a medical professional, you tell them, we are also thinking about cancer, but we need these investigations to rule it out. They might not feel it as they hearing it from you for the first time. So with this, I think that's the advantages I perceive so far.
Okay, so I want to ask you this follow-up question. So here lies the case that this AI is not restricted to only health professionals, where maybe health professionals will use this information to treat patients, but then the patients also at home can also access the same information. So do you really think it's a good thing? Because I'm thinking otherwise, because if I know that if I am sick, I can just go online and then Google where my symptoms and signs, and then even tell AI to give me the drugs that I can use to treat it. Sometimes I can say that it might limit them coming to the hospital. So is it really, really like entirely a good thing that patients have access to this AI even before they come to the hospital?
Okay, this is a perfect question. So, as already discussed, these were the advantages. Every technology, every development, everything that we want to come in with has its own pros and cons. So the advantages are what you talked about. The disadvantages are also some of the things you are trying to point out. Here, the disadvantages are they might be solely dependent on the AI that at a point they wouldn't want to seek medical attention because coming to the hospital is very stressful. You'll be in long queues, you join a lot of people, you hear a lot of things, you see a lot of some people even feel comfortable seeing blood when they come to the hospital.
Wow.
So in this aspect, the person might be more dependent, and because of that, they'll be restricted. But as already discussed, I said that even at the end of an AI's prompt or an AI's answer, they tell you that if you suspect these are your symptoms, feels like you're having hypertension, but if you feel like you are having these similar symptoms, go to a professional for clarification or diagnosis. So an AI already is prompting them. So here, with the medications, every over-the-counter medication an AI will suggest, or AI will suggest all the medications that's possible for you. But the dosing and all those things, AI might give a range telling you that it's from 100 to 500 milligrams. And it's a doctor that will tell what the specific milligram you give to you based on the other informations you gather from you. So even if they get all these access, they are still limited in a way. If the drug is supposed to be prescribed, that means they cannot still get access to it. They would have to come to the professional. As I've already said, they having too much access might have both its positive and negative side. So I feel like we need more education or we need more regulatory system for this AI if we want to visibly or on a long term incorporate it into our health system in a better way.
Yeah. Thank you very much. So, Boss Nicholas, I want to come to you. So, more on the benefits of integrating AI into healthcare.
Okay. So he has talked about the fact that it will increase patient adherence to medications and influence their health seeking behavior. I would also want to talk about the part of healthcare that is not directly related to the doctor. For instance, administrative tax. So when you go to the hospital, they take your vital signs, someone entering here, go to the OPD, go for card and all those things. All these things can be streamlined, whereby you can just sit in your home, provide certain basic information, such that before you even come into the hospital to meet the doctor, all the logistics that they need to take care of you will be already there. So that will make the hospital time, like the time you spend at the hospital, very, very short, and will also ensure that the system is not overburdened like how we see it in this current Ghana we live in. Also, another thing is drug discovery. Many people don't know what goes into drug discovery before they discover paracetamol and then approve it for use by the general public. It goes through a series of tests, lab tests, a lot of them, even discovering the structure called paracetamol for it to be even used on animals before coming to humans for clinical trials for approval and all that. It needs a lot of human effort, a lot of repetitive tasks, testing here and there. With the advent of AI, you can just give the formula to the AI, give the information we know already in healthcare through genetics and other molecular techniques. And the AI can tell you that this drug has a potential to cure this cancer. This drug has a potential to serve as an antidepressant or that. It will save us a lot of time testing these things one by one before it becomes very safe for the general public to use. So integrating it into that will also help in the pharmaceutical space, whereby drug discovery and then even personalized medicine, where drugs are tailored to cater for certain individuals with certain traits will even be more accessible and then more should I say affordable, because you're not going to invest a lot of money into the multiple testing that the human being does. So that's another benefit we'll get from integrating AI into healthcare.
Okay, so far we have been talking about benefits, and just a few on the effects. So I want us to give more on the effects. So what do you think are some of the perceived negative aspects, the risks involved, or some concerns of integrating AI into healthcare? Because we can't entirely say that integrating AI into healthcare is a good thing, like totally a good thing.
Yeah.
Definitely there will be some bad sides to it. So I think any of you can start, any of you who's ready. I think, okay, I'll start with you, boss. Kofi Wache. Any negative aspect of AI?
Okay, so the negative aspect of AI is normally dependent on the regulatory factors you would have around the AI. So AI has just been made for us. Okay. it's able to analyze data, it's able to give us information. But what we do with the information and what the range at which we allow it to inform patients is where we would have to get a very good regulatory force. So one negative aspect is something like they typing in their signs and symptoms. Or maybe for a patient, they might only be able to tell them their complaints. So if they tell the AI their complaints and the AI suggests one differentials as cancer, they might scare the patient. Meanwhile, the diagnosis itself might be nowhere near cancer because AI just have this information around. It's just been fed with data. Yes. So it's knowing that, okay, so general malaise, right now they are having weight loss. The person, because somebody might just be going through emotional stress, and that might have caused the weight loss. But weight loss is also an important symptom to pick up if you are thinking of a malignancy. So if an AI gets this information, maybe three solid information being joined together, which suggests cancer, they might scare the patient with it. Meanwhile, if a professional is taking care of this same patient, they might know that this thing has nothing to do with cancer. You get it? So it's causing them fear and panic even before they get to our side. Even though I already said it's caused them to know a little bit about their information. So with this regulatory force, if they are being told that with sensitive informations like this, they should sugarcoat it or they should make it in a way where a patient won't be scared too much. Because before we tell a patient they have cancer, we go through a systematic form of counseling before we tell them. And with this, we've noticed that if you tell them through counseling, you are able to affect how they perceive the condition, and you giving them the broad range of options available for them. It will help them a lot. So the AI can scare the patient even before they get to us. That's one disadvantage I think we need to talk about.
Okay, so what I will add will be the influence of external individuals who are very well versed in the world of AI. As we've already established, AI is able to give out responses, or let me say results, based on the information it has fed and based on the models it's working on, right? So assuming I am very, very good in the creation of AI and the manipulation of AI models. And then these AI systems that are being used in the hospital, no matter what, cyber security will be an issue. And I have the ability to penetrate into this system. There is a lot of things that I can do that can harm patients. Yeah. Maybe these wars that we are seeing between two countries that are very good in the IT space, they can just infiltrate their system, manipulate their AIs with by feeding them with wrong data, changing some factors that the AI uses to prescribe stuff. And then in the end, it will be causing more harm than good to our patients. So that's another aspect of AI that many people are concerned about. And another aspect that other people, example is John von Neumann, who in the 1950s proposed that there will be a certain point in human life whereby we will have what they call super intelligent systems. That is AI that are more intelligent than humans, and nobody knows exactly what they will do to humans if they get to this point. There is also another proponent who says that in 2045, that is the point we will reach this, they call it technological singularity. That is 2045. I'm yet to actually believe that it's going to happen in 2045. Nevertheless, it's very, very vital that as we are trying to integrate this AI into our healthcare system, we also make sure that the data aspect, where the data referring to what we use to train the AI, is also not exposed to malicious individuals who tend to manipulate them to harm a lot of people for their own personal interests.
So I really think it's where we actually draw the line, like where AI can, the limits we have to give to AI so that we can be able to curb this kind of negative effects that AI can come about with. Okay.
Yes.
So I want to ask this question. So, Rana, what do you think if a patient is given the opportunity to choose between being cared for by AI and then a human, which one will you think the patient will opt for? The AI or human, and then why? I think I'll start with Nicholas.
Okay, so to answer this question, I'll use an article that I read recently. So it was an article that was published by a German journal that studied 1,813 individuals who are patients. So they wanted to find out the same reason why we've gathered here today. Can AI replace doctors? So they grouped the people into three groups. The first group saw a doctor with an AI. So the doctor was using the help of an AI. The second group saw a human doctor only. And then the third group saw an AI chatbot only. Okay, so they measured about five things: trust, mistrust, treatment adherence, privacy concerns, and information disclosure, among others. These were the metrics they used to measure the outcome of their experiments. Now, what they found out was that majority of the patients preferred the human doctor only, not even with the AI. Majority of them prefer to be cared for by the human doctor only, followed by the human doctor with the AI. And like it's just a small number wanted to be taken care of by the AI only. In fact, in psychiatry, they noticed that the AI was something human beings did not even want to interact with because of the various psychological things that people who present with psychiatric conditions come with. So that should tell us that even in this modern world where we are quite well informed about AI, many people will still prefer the touch of a physician. Many people will still prefer seeing the face of a physician, the reassuring words of a physician, as compared to that of an AI. Even if they want AI to be part of the healthcare system, they would want it to be integrated together with the doctor, working as a co-pilot for the doctor to manage them rather than just leave them into the hands of robots and certain systems for them to maneuver their way around them. So I think currently human beings would prefer being treated by another human being than an AI.
Okay, so I think I'll move to Kufubachi. So do you also side with him, or do you think that the patient will opt for AI rather than the human being or the health professional?
Yeah, I side with him because there was a research that was made years back, which they were actually trying to understand how patients feel when they come to the hospital, and they wanted to know if uh, a patient being examined or being touched by a doctor legally is actually helping in the health space. And a lot of patients raise concerns that when they come to the hospital and doctors don't actually touch them, they feel like they didn't come to the hospital because they want to be touched in order to decrease the anxiety that they come with. Nobody enjoys being coming to the hospital because nobody, apart from we that are working, apart from we having the hospital as our workspace, nobody enjoys coming to the hospital. Patients prefer physical touch. Patients prefer reassurance. Sometimes, some conditions, as I've already said, you don't even need medication. Some conditions, you just need the doctor to tell you that this thing, it's normal at this point, especially someone who is 50 years old and they are having irregularities in their menses. They might be very, very confused. But in this sense, if you go to a doctor and the doctor tells you, oh, don't worry, this is very normal in this phase. These are so, and we just treat the symptoms around it, the patient will be okay. And so in this space, a few people, I might say only a small fraction would choose AI compared to a real doctor. Also, recently we got the information that somebody committed suicide just because a response an AI gave to them was very disheartening. So, based on this, how many people would trust the AI again? The AI has no emotions. They are trying so much to make the AI feel. They are trying so much to make the AI feel like how humans feels, but it can't exactly be how we have a cognitive system. We have emotional system, and it's not structured. And AI will just type, "Oh, sorry for this," but it doesn't really feel like a human patting your back and telling you, I can actually feel your pain because I've been in this before. And then I will be like, oh, I understand this thing is like really confusing, but they don't feel what you are feeling. And that's what makes doctors so different. So if an AI prompt was able to make someone commit suicide, the trust level with them based on the current models you are having might be something that we need to look into.
Mhm. And then do we also think that this trust can go over time? Maybe it will get to a point where people will now finally give in and then give their trust fully, or give their trust fully to AI.
So people giving their trust fully to AI, as already mentioned, will be based on the regulatory and the development that will be made. So one, if it's well regulated, someone knows that. So a doctor, we are trained to be very confidential. We are trained to be very professional. If an AI model is being trained where our data cannot be leaked, our data cannot be accessed by anyone, and this AI model is so good, and it's also going through strict regulatory phases where it's supposed to corroborate with a doctor, and they know that even if AI is giving me a response, a doctor back end is also monitoring whatever is going on. If things go wrong, the doctor will set in and actually reply. So we are just corroborating or augmenting the whole process rather than making it strictly AI based. If it gets to that point, the trust levels will increase. And with that, even we will encourage the patient to start with that model because we will be behind us, monitoring everything that's going on. And if it gets to the time we have to set in, we would come in. And if it gets to this point, it's easier for a person to trust an AI model, regardless however we present it.
Okay. I think Boss Nicholas, you have anything to
Okay,
add?
so I think I'll stand on the earlier submission that you made about drivers and these self-driving cars. Initially, people were very reluctant to ride in these ones, but now I've heard about taxis that are self-driving that people don't really care because they feel like the car is, should I say, competent enough to send them to wherever that they are supposed to go to without any fear of accident or any fear of maybe misleading them to a different place. So with time, as we said, and then with the advancement of technology, day in, day out, people are researching into how to make AI better and better. With time, human beings will start integrating AI into their everyday activities. Now we rarely see them. Usually it's used by those of us who are kind of enlightened when it comes to this IT world. But now it's with time, our parents will start using them. The generation yet to come will also come and meet a world where we are dealing with chatbots, we are dealing with computer vision, self-driving cars. So it will become something that we will trust eventually. But then once again, I want to reiterate the trust that you give to a human being that you can see, feel, and touch will never be the same as the one that you give to a system that can feel.
Okay, so finally, looking maybe 20 years ahead from now, maybe 50 years, what role do you see AI playing in healthcare? I think any of you can start. This is a very general question. What role do you think AI will play in healthcare in the next 20, 30 years to come?
Okay. This is interesting. I feel like 20 years is even far fetched. I think because you see, even those that came up with this AI thing are even testifying to the fact that it's going faster than they imagine. We're all looking at AI developing to this point in the next 10 years from now, but we are having it now. Everything you have in AI is now. Okay. And the super intelligence he spoke about, it's something that they are actively working on. It's not like they've stopped. And look at, let's all, if we are used to foreign news, we look at a huge amount is being invested in the AI space. So thinking about all these things, it will tell you that they are all the stakeholders in this AI space is making sure to even run as faster than it is now. So back to your question, what role will AI be playing in this whole medical space? First space that I feel AI will play a major role with the radiological space. So radiology is reusing imaging to diagnose. So we have several aspects of radiology. And with this, you need professionalism. You need a lot. Even I think radiology, their residency is 4 years, which means they need a lot of years after medical school and after practicing. You need extra years before you enter this space. But currently, the AI models they are making around reading of these radiological investigations are near good, or even let me say better. They are not best. But if they are better and so good to the point that the margin of error is so minute. That aspect can really, really be good to us, especially to the less resource space. So radiologists in Ghana here, for instance, you might not have enough radiologists to be helping us. So if I'm in a space where I'm in a small hospital, or let's say a community hospital, and I don't have a radiologist, and I have this AI model who can interpret X-rays to me, because X-rays, it's so difficult to interpret. It interpret and get the diagnosis accurately. But an AI model has been fine-tuned to a point where they are able to pick the minute things within this imaging, and therefore they are able to pick up some things that a human eye might not even see. So, and it has started already. Radiology in AI has started already, and it's so good. I tested it, and I must say, even radiologists are confirming that the AI models around radiology is so good. So looking the years ahead, the radiological department will be so good. Also, looking at the research department. So right now, the AI can use a lot of informations based on whatever is being fed to it. That the patient. So let's say if we make a model where uh, even after the patient has been treated on a specific medication, they get home and they input whatever feedback into this AI system. After 5 years, the AI can analyze this whole data and tell which drugs are helping this particular condition best. Exactly. So in the diagnostic and even the research method, the AI can help us in a lot of ways that we can think of. So I think AI would help us in the radiological space and in the research space in the health sector.
That's wonderful. So what I also add is that you just imagine a society whereby AI is integrated to every part of the society, from healthcare to banking to home security to school to everything. Now there is a branch of AI called computer vision. So the self-driving cars that we see, they use computer vision. So as the car is moving, it can identify something and be like, oh, based on the data I've been fed with, this is a human being, I should stop. Based on the data I've been fed with, this is another car, I should slow down. Based on the data, there is a traffic light showing red sign, so I should what? Stop. So I feel like in the next 20 years, at the pace at which AI is being developed currently, we have such a society like that where it is integrated to every single part of our life, such that there will be a new branch of medicine known as proactive medicine. Now you have preventive medicine, it will be proactive medicine, whereby we don't wait for a person to get the risk factors before we try to prevent it. But even when you are born, we can even determine that based on these things that has happened in the past and the data that we have, at age 5, you are susceptible to getting malaria on this day at this point in time. And it will help us so much in preventing various preventable deaths that occur in this part of the world. Another point will be administrative tax, as I've already said. A lot of paperwork, a lot of sign here, do this, do that. With face recognition technology, fingerprint technology, sometimes it will get to a point whereby you just need a fingerprint to assess everything about yourself, healthcare, everything. And then I'm looking at a future whereby money will not be a physical thing, but rather something digital that AIs are helping to regulate and make sure everything is running smoothly. So AI will really, really play a large role in our healthcare, and then people should be prepared for it.
Okay. So what you guys are saying that in the near future or in the next 20 years or more to come, we are looking at AI being integrated into most of our spaces.
Exactly. Let's attest to the fact that AI has come to stay. Regardless the disadvantages, there are more advantages we can be looking at. Yes. Okay. So with this, we would have to think our mind in a way that how can we curb these disadvantages rather than focusing on them too much? Let's look at the advantages and now think about how we can curb the disadvantages so that we can corroborate it with the health professionals, we the human beings. And this is where some people might be saying that, oh, doctors are even using this AI to diagnose us. You see, that's what everyone is getting it wrong. You can't go to school for 6 years and come out not knowing anything. Yes. That's what they might think. Because just because you think a doctor confirms something doesn't mean that he doesn't know anything. Before you come out of medical school, you people have less idea the amount of information you have to know in your head to be able to come out as a doctor. It's not small information. Is it? And the checkpoint, there are regulatory bodies, there are examinations, there are because everything about us is between life and death. So there is no way your health system or your health service will just allow us or allow doctors to go and sit in consortium if they are not fit enough. So sometimes they are just corroborating. Honestly, I would want to talk against the fact that some doctors are so used to using their phone that they forget patients is sitting in front of them. And nowadays, we even use technology like typing on the machine. So we tend to be typing, and you forget a patient is next to us. And because of this, we shouldn't encourage that. But if there is the need for us to confirm something, there are a lot of information because immediately somebody sits in front of you and that person tells you, I'm coughing. You know the amount of information that come in your head just that split second. You're thinking about the lungs, you're thinking about the heart, you're thinking about the truth. You're even thinking about an allergy. So it's a whole lot of information, about 50 different diagnoses coming to your head. Immediately somebody tells you just cough. So you should know the kind of information you would have to delve down before. And sometimes you are human beings. We tend to forget some basic information. So the truth is one. Some people try to confirm certain things, but don't get it wrong with the fact that somebody confirming something doesn't mean he doesn't know anything. Because you cannot come out of medical school not knowing anything. It's not possible. You cannot survive in medical school if you don't know anything. And before you come out, the regulatory bodies and the health system make sure that you are fit enough, you are good enough for this profession before you're allowed to go out. Corroborating with the AI in a way that based on our local guidelines, our local systems, we are able to come out with the perfect diagnosis and the perfect way to help our patients get better. That's all that we are seeking for. So AI, we are looking at it really helping our system, but in a very regulated and a very meaningful manner.
Okay, and then looking at this integration as well, do you think that this integration would or AI would create new health jobs in the healthcare system?
Well, let's face it, AI will replace certain aspects of the healthcare and it will displace certain individuals. At the same time, AI will create certain spaces for certain individuals to also step into the healthcare system. For instance, AI can handle administrative tasks. Therefore, we wouldn't need an administrator anymore. We wouldn't need someone to be at the OPD giving out cards and all those things because AI can be automated such that you can just use your fingerprint to access healthcare. So these individuals are at a risk of being displaced. You mentioned radiology. AI is advancing. The concept of computer vision and the other aspects like neural networks and deep learning, it will get to a point you wouldn't need a radiologist to even give you a report that, oh, this x-ray shows pneumothorax, this x-ray shows that. AI will be so good that hospitals will find it difficult hiring radiologists. Same for pathology. Anything that deals with seeing and corroborating it with maybe some established facts in a textbook, AI can do that. And so it will displace certain specialties if yes, I stand to be corrected, but certain specialties will definitely be affected. At the same time, now we'll be having new professionals joining the healthcare, like AI engineers and cybersecurity experts to protect the data and whatever that the AI is working with. People who are mathematicians who actually build the models on which these AI systems run. All these individuals who are currently not well integrated into the healthcare system will be needed to cater for certain for the system that you are integrating, that's the AI system. I believe there are other aspects of AI that human beings are also yet to discover. So when we discover those aspects, we also need the experts to come and handle those things in the healthcare system. So yes, it will displace certain individuals. At the same time, it will create jobs.
Okay, that's wonderful. Okay, so finally, I want us to give our general view on AI and in medicine, like AI being integrated into medicine, the benefits, their disadvantage. Just your general thoughts about AI and in medicine.
Okay, so what I would say is that yes, AI is with us. It will be with us and it will continue to be with us. Let us develop the mindset and habit of accepting AI and integrating it into our daily lives. It really helps. At the same time, I also want to implore to the various stakeholders that are involved in the use of AI to also not just limit it to a point whereby the whole of its benefit will not be, should I say, realized because we feel it might affect certain individuals in a negative way, such as displacing someone from work. We should make use of the AI to save more patients, to save costs, and also make medicine accessible and affordable. Thank you very much.
Okay, and then Mr. Bache.
Okay, so for me, as I've already established my fact of AI has come to stay, so the only thing we have to do is just have a good regulatory bodies around it. Make sure we can corroborate it with doctors, and we working hand in hand would help us twice as what we are doing now. We can't work separately because if we take AI out of the medical space now, we might feel so uncomfortable because there are certain things that AI can do that we might not be able to do now. So, and there are certain things that we too we can do, as in the examination. And somebody might raise the topic of robotic surgeries can do. Nah, you still need a doctor to diagnose the appendicitis and place the robot near the patient and tell it what we are doing today before they can help you do it. So you realize that it's just all about collaboration. It's never about we standing individual. If we work hand in hand, we are going to create a very beautiful health space. And it's rest assured that if it's well regulated, we are going to have a perfect ecosystem where we'll be thriving in good health and a perfect psychological and emotional well-being.
All right, so this has been a very wonderful and then an interesting session. Thank you guys for watching to the end. So don't forget to like, share, and then subscribe. And make sure that you share your thoughts as well in the comment section on AI versus healthcare. Can AI really replace health professionals, especially doctors or nurses? Can AI really replace them? Just share your comments. So till we meet next time, thank you. See you.
Bye bye.
Ah.